Hi, welcome to today's webinar, an introduction to the revised National Ombudsman Reporting System, or NORS. My name is Amity Overall-Labe. I'm with NORC, and we're so glad that you're here with us today. Attendees of today's webinar include both state ombudsmen and representatives of the office. Representatives of the office are our target audience today. State ombudsmen have had other opportunities to learn about the revised NORS, but for many of you, this may be your first opportunity to hear more of the details. Today is the first of 5 webinars created specifically for those of you in the field who provide direct ombudsman program services. You'll hear from 2 other presenters today, Louise Ryan, Ombudsman Program Specialist with the Administration on Aging, Administration for Community Living, and Maria Green, a consultant with NORC. Today's agenda includes a NORS background, overview of the basics and data with a few examples, a review of the upcoming training dates, and an opportunity for questions. All attendees are currently muted. If you have questions, please submit those in the control panel on your screen. We'll try to address as many of the questions as possible after the presentation. As you may have heard already, this webinar will be recorded and posted on the website with all the webinar materials shortly after the webinar today. Today's slides and the tables we discuss are attached in your toolbox as handouts. We will also send a follow-up email to all attendees with a certificate of attendance that you can share with your supervisor to verify your participation in today's training. So Katie, if you'll queue up our first poll question, we're going to have a few poll questions throughout today's webinar. The first question is, what is NORS? Please choose the correct answer. Naturally Occurring Retirement System, National Ombudsman Resource Service, or National Ombudsman Reporting System. Great. All right, it looks like most of everyone has responded. We can go ahead and close the poll and share the results. Okay, just 1 second. Sorry about that. There we go. There's the results. So 15% said National Ombudsman Resource Service and 84% said National Ombudsman Reporting System. So the correct answer is National Ombudsman Reporting System. So just 1 moment and we'll get back to the slides. Sorry about that. There we go. Some of you may not have heard of the National Ombudsman Reporting System because in your state, the software system that you use to collect NORS data may be called something else. The data entered into your state software system is usually used by the Office of the State Ombudsman to compile the state's data to submit to the federal agency, the Administration for Community Living, or ACL. NORS brings consistency in data collection and reporting nationally for the work of the Ombudsman program. Some of you may provide services such as home care ombudsman work, managed care ombudsman services, or other advocacy services that are beyond the scope of what the Older Americans Act requires of the program. And your state software system captures that data related to those services. Today, we'll only be talking about the data and codes associated with the Older Americans Act requirements of the program. In addition to what you learned today, and in future NORS webinars, you may wish to discuss with your ombudsman what state-specific data collection is required at the state level. Now I'd like to turn over the webinar to Louise Ryan, Ombudsman Program Specialist with the Administration for Community Living. She'll briefly talk about the history of NORS and explain the reason for the changes.
Good afternoon, and thank you all for joining the call today. So I'm going to give a little background on why do we collect this NORS data and what do we do with it. So I think the beginning reason and a big reason is that it is a requirement of the Older Americans Act. which says that the state agency, which basically means the State Unit on Aging or State Unit on Aging and Disabilities, however your state calls it, that they are to establish a statewide uniform reporting system for the Ombudsman program to use to collect and analyze data relating to complaints and conditions in long-term care facilities and the issues that residents experience and the problems that they experience. And from that data that they collect, then the state ombudsman is required to report that data and share that data. So specifically, it requires him or her to share the data with the licensing and certification agency, various state and federal entities that the ombudsman thinks it's important to share with. Most important is that they have to share the report, what we call the NORS report, with the Assistant Secretary on Aging. And that is now our Assistant Secretary on Aging is Lance Robertson, and he's also our administrator of ACL. And so the way that state ombudsmen have to share that report is through a reporting tool that ACL builds through a contractor, and the states report that way. That's their official reporting to the federal government. But additionally, the data and the report, however, state ombudsmen also may capture that data and report, maybe in a nice, nicely put together report, that is also to be shared with the Ombudsman Resource Center. So there's a big requirement in the Act. Okay, next slide. And so from the Act, we then get to NORS. So NORS is trying to kind of quantify and put some parameters around the requirements in the Act. And many of you, I'm sure, are familiar with what is in NORS. We call it a data collection, and basically it has the elements that are required from the Older Americans Act. It, as you know, has cases, complaints, types of complaints and their outcome, consultations or information and assistance. And then it has program information like how many staff, how many local ombudsman entities, numbers of volunteers and hours, how much money was spent on the program, also activities that you may collect such as non-complaint visits, resident and family councils, so a variety of things, including, for instance, I don't know if I said, and you can see it on the screen, numbers of volunteers and the hours donated. That's a very helpful and important measure that we use when we share the NORS data. Additionally, state ombudsmen have to write narratives to describe what we call systems issues. So what are the issues that residents experience in a broader level? What are the barriers to resolving those problems? And what are some of the strategies the Ombudsman program might use to address those problems and resolve them in a more global way, maybe through policy changes or legislative changes. Additionally, there's optional narratives to give a case example or to describe a legal issue. Next slide. So what is changing? As you can figure out, one thing that is changing is the NORS data collection. Basically, we've got kind of two parallel changes happening. One is that we've revised the NORS data collection, and two, the reporting tool that state ombudsmen use to report their annual NORS data is also changing. And so today and for the next 4 webinars, the focus of these will be on what is changing in NORS. And again, NORS is not going away. It's just been revised. And I'm really happy, and I hope you'll be happy with the revisions. So the data reporting tool, or the software that state ombudsmen use to report their NORS data, is changing in a big way. And so with that change comes specific technology requirements in order for the ombudsman to complete their report. Currently, state ombudsman programs can manually enter all the data. They can literally type in the number of physical abuse complaints in a nursing home or anything like that. It can all be typed in. And in the revised NORS, we are changing that so that the complaint data in particular has to be extracted from the software that your program uses into a separate file, and then that file will be uploaded into the new software system called the Older Americans Act Performance System, or OAPS. And just so you're assured, there is no identifying information released in this process, but we will be getting tables that will have the case and complaint code and resolution and everything all in one package. So, and I'll describe a little bit more about why we want that in a few slides. Next slide. So, and why are we revising NORS? We are revising NORS in part to address past criticisms of in particular, when other federal agencies have looked at our data. And then of course, state ombudsmen have also had criticisms of our data collection. So we've had, some, it's been great in some ways, but it's also not been ideal. And we want to do a few things like increase the reliability and accuracy of the data, simplify codes and the number of data elements, streamline reporting by states, and in particular to reduce the manual entry in order to avoid errors in the complaint and activity data. And just a quick example of a few agencies that have been critical. The Office of Inspector General in the past has looked at the State Ombudsman nursing home data, and they looked at the NORS, and they said, you have way too many complaint codes and everybody interprets them differently. And then another federal agency, the Assistant Secretary for Planning and Evaluation, had a similar analysis and just said, you've just got too much going on here. So that's in part one of the reasons why we reduced the codes, but we also had other reasons, used other reasons as well, like some codes people just aren't really using, so we maybe need to merge it with something else. Next slide. So some of our goals for this new data collection and new reporting is to really help at the federal level in particular, ACL's ability to understand and report on ombudsman program operations, the experience of long-term care facility residents, and also kind of staying abreast of changes in long-term services and supports, policies, research, and practices, because what state ombudsmen report out in the field that they report to us helps kind of inform us about maybe emerging trends or trends that are growing and becoming a bigger problem. So it's, we think with this new method we'll have richer data that we can do more analysis of. Next slide. So for example, and this is the thing I'm so excited to get down the road, right now I know that maybe there's 200,000 complaints, and of those 200,000 complaints, 60% were fully resolved, right? But I can't tell of those, let's say, abuse and neglect or exploitation complaints, how many of those were resolved? How many were verified? We don't have that ability right now. Most of you have that. I'd say probably all of you have that ability at your state level, that you can run reports and you can look at the complaint codes and see how how they were resolved or not, or were they verified or not, to those distinct codes. So that's the what we would call disaggregated data. So by the states uploading complaint tables with the data, it means we'll be able to do some deeper analysis of the data by type of complaint and just get a better sense of where our ombudsman program's effective with complaint resolution and maybe what types of complaints they are less effective, and maybe we need to look at how do we provide additional technical support. So that's just an example. Next slide. This one, I just really can't stress enough that we really do use the data. We use the numbers, we use the narratives, and more we're using this data. So we always use it for budget justification. We have to develop outputs and outcomes measures, and that is turned over as part of the budgeting process, both at the congressional level and at the president's level for their budget proposals. We also use this to inform our federal partners. So for instance, with CMS, the Centers for Medicare and Medicaid Services, they write the nursing home regulations and are responsible for the oversight of nursing homes. We use the NORS data when those regulations were being revised to really call attention to the problems of improper eviction and discharge. And it was those numbers and the narrative examples that really helped to push some changes in those regulations around transfer and discharge, which for the betterment of the resident and for the program to better respond to residents. And as you probably know, state ombudsmen use their data at state and local levels to inform the public, raise awareness, and inform policy decisions. And I imagine that many of you also use this NORS data in a variety of ways. The other thing that also is happening, and you may have noticed this yourself, that there's more media stories that cite NORS data. Now, they might not always say it's the Ombudsman program. They might not say it's NORS data. They might just say the Administration for Community Living. So you'll see it in different ways. But you can see there's a few examples here. Consumer Reports, CNN, NPR, so a variety of examples. Next slide. So just a quick history. The work involved to revise NORS has been, it's been a work, I'd say a never-ending process. So when I came on to the Ombudsman program in 1997, there was work being done to revise NORS. And it's just always been evolving. So the NORS began in 1996, and over the years there have been minor revisions. Along the way, there have been various recommendations on how to improve NORS. So, for instance, as I mentioned, the Office of Inspector General, the state ombudsman themselves, NASOP, the State Ombudsman Association, had a strategic planning retreat. And from that retreat, there was a report called the Bader Report, which had recommendations around NORS. And basically, one of the recommendations is where we are today. We're kind of living out that recommendation. So we're about 16 years down the road, but we're finally there in terms of being able to have disaggregated data at the federal level is one of their recommendations. So, and also from that strategic planning, there were things like the work group to improve NORS consistency. That group worked with the Resource Center to develop the training that we currently use. And so there's always been this involvement over the years of state ombudsmen and representatives of the office giving feedback on how data should be collected. Next slide. So now we're getting up to, I didn't highlight the car analogy, but we're up to a 2019 car, I'm proud to say, with our new NORS. So, and this took a while to get to this point. So early on, we had a work group that we called NORS Next. And the NORS Next included, again, state ombudsmen and representatives of the office to help give feedback on the early drafts of our new NORS. Also, we had a training group in the training materials that were developed now. And so they have, contributed to what you're experiencing now. Also, the other part of this is when we finally got our final NORS data tables, those have to be approved by the Office of Management and Budget, and that means it goes through a clearance process. So there is many people commented on the data collection, the tables and the definitions, and so we really listened and responded to those and made changes based on those recommendations. And then as all that was going on, we're also building the software. So we had several states pilot test the Older Americans Act performance system. Now I'm going to turn it back over to Amity to administer another poll question. Thank you.
Thanks, Louise. So our next question, we'd really like to get an idea for how many of our attendees provide training to representatives on how to use NORS codes and definitions. So if you could please respond to this poll question, and Katie, go ahead. Thank you. Great. Looks like we have a lot of responses, so we can go ahead and close it and share the results. Excellent. So it looked like there are the results. 53% of those on the line today provide training to other representatives about NORS, and 47% don't. I do want to let you know that we will have a lot of training materials for those of you that do train representatives on NORS, and so that's what the upcoming webinars are going to be all about. So thank you, Katie. I'll hide those results. Great. And can you see my screen? There we go. Perfect. All right. So thank you for responding to that. And, oh goodness. Sorry about this. Just one second. I don't know why the poll questions do that. I apologize. Bear with me. And just to remind those of you already on the line, we've received several questions in the chat box already about whether these slides are available. They're currently available along with the tables for downloading in your toolbox as handouts, and they will be available with the recording after this webinar. So now I'd like to introduce Maria Green. She's a consultant with NORC. Maria is going to walk us through some of the significant changes in the revised NORS. And please know that we do understand this is a lot of new information in one webinar, but there will be links to the tables discussed today. They're also available as handouts, and we'll go into a lot more detail about how to report your work using the new codes and definitions in the upcoming webinars. So Maria?
Hello, everyone. This screen, I don't want to overwhelm you. The intent is not for you to try to read certainly very tiny print, but just to remind you that the instructions and complaint codes that you currently use are on the left-hand side. Today we're going to talk about the revised NORS tables, and we use the word tables now to describe Table 1, Table 2, and Table 3. So it's a little bit different structure than what you use on the left-hand side. It's called instructions, and complaint codes. Next slide. So there are 3 revised NORS data collection tables that representatives will be using to do coding. These 3 tables will replace the current NORS instructions, but only until it's effective October 1st of this year, 2019. At that point, we'll remind you, we'll give you plenty of reminders, and as we do these webinars, you'll be reminded too that keep using the codes you're using, the instructions, but when it comes time, we're going to tell you to throw the old instructions out the door, start using the new tables. Table 1 pertains to case data components. Table 2, complaint codes and definitions. And Table 3, state program information. During the next several slides, we will discuss the tables and highlight some of the changes from the current NORS with a focus on what you might use most. For the vast majority of states, the National Ombudsman Reporting System, or NORS software, will be updated by the state ombudsman program's IT vendor and/or the state IT staff. The purpose of this and upcoming NORS webinars is to provide guidance around the data collection and recording for ombudsman representatives, and not about the Administration of Community Living's reporting software, which Louise mentioned earlier, because the state ombudsman will have a lot of opportunities to even learn more about the Older Americans Act Performance System, which they call OAPS. Next slide. This one's going to show the very first page of Table 1, case data components. This is just a quick screenshot. As a reminder, as Amity said, it's also available in the handouts there. This table is 10 pages long, so you're just seeing the first page, and it explains what components each case must have to be reported in NORS. For the purpose of today's webinar, we're only introducing the tables and giving you some highlights. All the upcoming webinars are going to go more in depth about the tables. Next slide. So the highlights of Table 1. It's really all the case data components. Most of this information is not new to you. It should feel very familiar, look very familiar. Currently, a case includes 1 or more complaints brought to or initiated by the program. In reporting the case, the programs have to identify the complainant, complaint code, type of facility, verification, and resolution for the complaints. The changes are in the red font. In the revised NORS, programs now have to enter a code for the perpetrator of abuse, neglect, or exploitation, meaning coding whether it's a facility staff, another resident, a family member, resident representative, a friend, or other individual who is alleged to have caused the abuse, gross neglect, or exploitation. Also new in the revised NORS is the referring a complaint to another agency. It used to be a disposition code. Now you're going to enter a code for what type of agency the complaint was referred to. Next slide. So this one is a closer screenshot of Table 1 case data components. What I want to highlight on the far left-hand side, you see the green arrow. It's going across the top headers that are in blue. This is how you will read the table and best understand the information that's contained there. The element number is a coding for the software. Data element, that's the second one from the left, is the name of the data element. For example, date, case opened. Definition is the definition of the data element. An example would be the date the case is opened is the month, day, and year. Then there's a quantifier to tell you if it's a single or multiple codes are allowed. There's a type. This is an alphanumeric code or a date. There's codes and values. There's coded elements such as O1 might be resident, O2 might be resident representative, family, and friend. And then, very important, I think, is the examples and reporting tips on the far right. It's going to give you even more explanations or tips on how to code your information. So all of these tables pretty much are set up in the same way with a code label definition, codes and values, examples, and reporting tips. This one I want to give you just a very specific example. So you're looking at table 1, case data example, and look where we've highlighted it with the green oval. For this particular data element, the first one at the top, it's about facility or setting. So under the code and values column, you could choose O1 for nursing facility, O2, residential care community, and 99 would be other setting. So currently in NORS, a residential care community is what you know as a boarding care facility. The 99 code, other setting, is a code that you might use to describe the additional work that your state does that's not Older Americans Act services. NORS code name, the new name for boarding care, which is called residential care community, does not change what you may call these facilities in your state. This is just what we're going to call it within NORS. That's a residential care community. The bottom one I want to highlight, the oval, in the second tier, is the code values, O1 through O8. That's your choices for who might be the complainant associated with a case. There is an addition here on the code values, and it's the resident or family council. There's also been some other merging of other categories from the current NORS. This was one of the recommendations, was to reduce so many of the complaint codes and has grouped them in larger groups. If you're ever in doubt about which is the right code to choose for any case component or activity, we recommend referring back to the reporting tips, the training curriculum. Also consult with your supervisor or your state ombudsman office. Although all the data elements in the table have a code, and we may refer to those codes during the training, your software or the forms that you currently use in your state may have different codes that map behind the scenes to the NORS codes. This is why it's very important that you understand the guidance and instruction from the Office of the State Ombudsman Program regarding your state-specific software. Next slide. This one's just highlighting that change that we were talking about, that starting October the 1st, the codes for type of facility or setting will be nursing facility, residential care community, and other setting. So once again, the biggest change there is that what used to be called boarding care will be coded as residential care community. In your everyday practice, you will probably not notice a difference. For example, I know most states have a variety of types of licensing for their residential care community. So in your state, you might know it as assisted living or adult foster care home. That will not change. Even though at the federal level, they're going to identify it and label them as residential care communities. Other settings, formerly other, is an optional code, and that's the one that I was explaining, that in your state, if you do other ombudsman services beyond those required by the Older Americans Act, you may choose to code it here under other settings. Let's go to the next slide. This is another specific example. You remember I referred to referral agency and dispositions. So the referral is no longer a disposition code. The referral agency is now a component of a case, which is defined back in Table 1 as the agency or agencies to which a complaint was referred to as part of the Ombudsman Program's plan of action for complaint resolution, such as you may refer a complaint to the State Licensing and Certification Agency or to the Adult Protective Services Program. The number of disposition codes, meaning the final outcome of the complaint, has been reduced from 7 to only 3. Those 3 codes now are fully or partially resolved, withdrawn, or not resolved. We'll go into all of these details in future webinars, but this just gives you a quick peek into some of the changes. Amity, I'll turn it back over to you to administer the next poll question.
Thanks, Maria. So based on what Maria just shared, this poll question, if you've opened a new case and the resident is in a board and care facility, which facility code should be used? Please choose the correct answer. 01 for nursing facility, 02 for residential care facility, or 03 for other settings. Katie, thank you. Great, thanks. I think we can close the poll. It looks like most have responded. And according to the results, 92% said residential care facility. So great job, that is the correct answer. Just one moment and we'll get back to those slides.
I don't know about the rest of you, but I love the screenshots on Amity's computer. That was a beautiful photo.
Thank you. I can't take credit for that. But the residential care facility is the correct answer. As Maria has already noted, but as you can tell, we're going to be repeating quite a few things over this webinar and future webinars just to make sure that we get them, because it's a lot of new information. So in the revised NORS, board and care facility is now referred to as residential care facility. And just simply as one last reminder, states have a variety of names for their residential care facilities, such as board and care, assisted living, or even adult care facility. So although board and care is now residential care facility in the revised NORS, that doesn't change the names at the state level. So I'm going to pass it back to you, Maria. Thank you.
Okay, thanks. So we have 3 tables, right? We've talked briefly about table 1. Now we're switching over to table 2. That's the one there in front of you on the screen, and it's the complaint codes and definitions. When later after the webinar, when you get to looking at this table, you'll see that it's 21 pages long. It explains the complaint codes and the definitions that are in the revised NORS. Next slide. The next slide is going to give you the highlights from Table 2. So there, in the revised NORS, there are 59 complaint codes. So that's a dramatic reduction in the number of those complaint codes. Currently, NORS has 133. And based on recommendations from you, many of those codes have been merged into larger categories. The revised NORS has 59 complaint codes. And for those of you who have memorized all of those codes, it might take you a little time to learn the new codes, but we've got faith in you. You're a smart group. We've also created resources in simple formats showing the changes side by side. So little cheat sheets there for you. And because so many of the codes were not used in the current NORS, they were eliminated or incorporated into other complaint codes. And like I mentioned, we're going to have a crosswalk. So you'll be able to see what has changed and what is now merged into another category. And we think that the best mindset to get in starting October the 1st, though, is not to focus so much on the crosswalk, although it will be there for your reference, but just to start using the new tables. there's going to be complaint code categories. You see them there on your screen, A through L. Category A is for complaints about abuse, in which you must select a perpetrator code. It's new. Category B through J are for complaints against the facility. Category K is for complaints against other programs and agencies. And last but not least, Category L is for complaints against others not associated with the facility. Next slide. This is the top portion of the first page of Complaint Codes and Definitions, Table 2. You'll see there in the green box where the arrow is pointing the definition for complaint. So you're frequently going to see, once again, definitions, examples, reporting tips. I won't read it to you, but because it's the same as what you know it as, it has not dramatically changed. But with the abuse codes, we're going to use this section for serious complaints of willful mistreatment of residents by facility staff, resident representatives, families, friends, other residents, or an outside individual. You'll indicate who appears to be the cause of the abuse, neglect, or exploitation. So there's going to be a choice. You're going to choose if it's the facility staff person, that's going to be 01. 2 is going to be another resident. 3 will be resident representative, family, or friend, and 4 will be other. This is new in the revised NORS, especially because current NORS doesn't ask you any information about the accused perpetrator. Next slide. So we're still on Table 2, but what I wanted to do, again, just for a reference point, like we did for Table 1, is look down at the arrow on the bottom left-hand corner and just quickly go over the label with you there about how to read these tables. So the label is going to be the data element name, such as abuse, physical. Then you'll have the code. It will be the, like A01 is the code for abuse, physical. Then there's the definitions for the complaint code, such as for physical abuse, it would be the intentional use of physical force that results in acute or chronic illness, bodily injury, physical pain, functional impairment, distress, or death. And then if you wanted any more clarification about that definition or any of the information about physical abuse, you'd look for the tips and examples. So for instance, under physical abuse, that includes hitting, slapping, pinching, kicking, etc., and or controlling behavior through corporal punishment. Next slide. So we've pulled out just the complaint data example, kind of focusing on abuse, gross neglect, exploitation, since we just spent on the previous slide some time talking about that. Codes 6 and 7 no longer exist, will no longer exist in the revised NORS. A6, the resident-to-resident abuse identifies the type of abuse by selecting the appropriate codes. So it might be that A1 through A4, depending on what type of abuse, you would select that, and then you would select the resident as the one being the perpetrator if it was a roommate situation where 2 residents were getting into an altercation. You're only going to use the perpetrators, identifying the perpetrators for the abuse, the gross neglect, and exploitation complaints. Also, a lot of you may have memorized or know that the current NORS system, there's the P as in Paul, that P code for system and others, where you might have identified abuse, neglect, abandonment by family members, friends, or guardians. That is, or also someone while they're out on a visit outside of the facility, will be reported as either the abuse, gross neglect, exploitation A code, and you'll select if it's either family, resident, friend as the perpetrator. Next slide. We've been talking a lot about perpetrators, so let's talk about why it's been added. In the current NORS, there is sometimes confusion and miscoding because there are duplicate codes that describe the abuse. This addition will provide ACL with a better understanding of the types of abuse, gross neglect and exploitation, and some information about the perpetrator. It will increase the information available about abuse and improve the ability for all of us to analyze the data and for ACL to analyze the data. Requiring a code for perpetrator, for example, in the one where there's resident to resident, maybe financial exploitation, but there's not a clear way to reflect that in the current system. In the past, we've also had some confusion between the A abuse codes and the P systems codes have been confused. So hopefully with this change and this revision, it's going to cut down on any misunderstanding or confusion that has been prevalent. Next slide is a poll, so I will turn it over to Amity and Katie.
Thanks, Maria. Okay, so final poll question based on what was just discussed. And before we actually get to that poll question, I want to provide a clarification. I misspoke earlier. I accidentally said residential care facility instead of residential care community, which you may have noticed in some of the slides. And I did not do that on purpose to make sure you were still paying attention, but maybe that worked. But it is residential care community. And as you can tell, these codes and definitions are new to us as well. And even though we are working with them often, we still may call them what they are called in other states or programs. So sorry for that, and just wanted to clarify it. So the poll question: a resident who lives in a nursing facility told a representative of the office that a staff person hit her while she was in the shower. Please choose the correct answer for perpetrator. Is it O1 for facility staff, O2 for another resident, O3 family, resident representative or friend, or O4 for other? Please go ahead and enter your answer. Great. So it looks like 100%, actually 97% now, said facility staff, 2 said another resident, and 1 said family, resident representative, or friend. 0 said other. So thank you for taking that poll question. Give me 1 second. We'll get slides back up. So Maria, back to you.
So the correct answer is the facility staff. Good job. The next screen, when we get to it, is going to show Table 3. So we've talked about Table 1, Table 2, now we're to Table 3, State Program Information. This table is actually 35 pages long and explains the elements that the State Ombudsman Program will use to report their program activities. The majority of the program information is compiled and written by the Office of the State Ombudsman. However, we will provide an overview and share an example or so of how your work in record keeping is reflected in the program information submitted for Table 3. Next slide will show the highlights. Most of these are the responsibility of the State Office of the Long-Term Care Ombudsman and is not significantly different from their current reporting requirements. You know, back earlier, Louise was talking about where there might be a narrative where they're given the complaint example or the systems issues. That's still being asked, and that's very, it sounds like more and more from what Louise has shared that it has been helpful to ACL, and especially when they talk to policymakers or to media to help them understand not just the numbers in the data system that are reported, but something that connects it to real casework, and those narratives are so helpful. There are some significant changes to the reporting of Ombudsman program activities, and it's in red font there, and we'll describe those changes in a moment. Let's get to the next slide. We're being consistent, even though it may be painful to look at, we're being consistent. I want to show you this table 3, just the headers there. So if you look on the far left-hand corner at the arrow going across the top, that will tell you how to read this information. Now for table 3, you know, it was a lot of pages. It kind of changes part way through when you look. So the one that is showing now shows you the composite data element, which for this first one is the complaint example. On down into the table, it might show you, for instance, in that column, what is the data element. The next column is element description, or later on in this table 3, it may call it element definition because it's asking for something different. There's the quantifier. It's going to tell you if something can have one code or multiple codes. There's the type, if it's alphanumeric code or numeric. There's the codes and values. So there's a whole lot of coded elements. You'll notice that we're putting 0 in front of everything. So like O1 nursing facility, O2 residential care community. And then one of our favorites, the examples and reporting tips, because it's going to give you ideas of how best to respond to the requested information. Next slide. We're going to talk about H, the Ombudsman program activities. And these will look familiar to you because it's something that you already do and that you report in these categories. But there are changes in the revised NORS, and they're highlighted there in red. So it would be under Ombudsman program training and the visits. Next slide. So for the federal level and the NORS, it's been simplified. We're just asking for less information about the program training. However, your state ombudsman may want you to continue to report training at a more detailed level. So it's always going to be important to confer with your state ombudsman and clarify what additional information may be collected and reported in your state. The reporting of program activities also has been simplified. For example, the state ombudsman currently reports the number of training sessions, hours, and number of trainees for the ombudsman program training. In the revised NORS, states will report the number of certification hours. That means the total hours of training required to achieve certification and your designation, the annual number of continuing education hours, and the total number of individuals completing the certification training. Also, states will now report all visits, those that are related both to complaints and those that are routine, like your regular visits, not in response to a complaint. This change may not be new to your state, but it is in NORS. Okay, next slide. This is Table 3, Program Information Example. And this screenshot is showing the information of it relevant to visiting nursing facilities and residential care communities. NORS will collect the following visit data for both nursing facilities and residential care communities. So what's being collected is the total number of facilities that receive at least one visit by a representative, total number of visits to facilities no matter the purpose of the visit, both complaint and non-complaint related visits, and the total number of facilities visited not in response to a complaint in all 4 quarters of the reporting year. Just as a reminder, most of the information in Table 3 will be completed by the Office of the State Long-Term Care Ombudsman, but the work you do every day is invaluable and reported in the program activities. We will discuss in more detail about tracking your visits, but it is important at the state level to document and enter all the visits into the state software system. Now I'm going to turn the webinar back over to Amity to help us wrap up and go to questions and answer period. Thank you.
Thank you, Maria. So just as a reminder, Ombudsman programs will begin using the revised NORS codes, definitions, and activities on October 1st, 2019. So that's the beginning of federal fiscal year 2020. And to add some more dates in there, the Office of the State Ombudsman will submit that federal fiscal year 2020 data in January 2021. So there are several components of NORS, as Maria just touched on, such as the narrative examples of advocacy work that the Office of the State Ombudsman writes and submits along with data to the Administration for Community Living. So a lot of the components discussed, especially in Table 3, and that information that the Office of the State Ombudsman files in January 2020 and reports to ACL, you won't have direct actions in submitting that data. You record and report your activities to the State Ombudsman, and the State Ombudsman turns around and reports it to ACL. So today's webinar and other upcoming webinars in this series will highlight the areas of revised NORS that are really pertinent to you and your work. So please remember, do not use the new codes or definitions we're discussing now until October 1, 2019. So we wanted to remind you of the upcoming NORS training by NORC. Since you've already registered and attended this webinar, that means that you are registered for all of the entire series, so the following 4 webinars that are coming up. The webinars will review the data elements and will provide specific case examples. So for those of you that are familiar with the current NORS, you may already use the NORS training materials that are available on our website currently. We've been working on, as Louise mentioned in her presentation, on revising those materials to reflect the revised NORS. So those revised training materials will be released prior to each webinar, shortly before each webinar. So in order to provide this live for everybody around the same time. So we're not releasing all 4 modules at the same time. One will be released before each webinar. And the reason we're doing this so early, prior to October 2019, is we hope that once we get through this webinar series, that you, State Ombudsman, and representatives of the office will use the materials that we will have available. So the PDF versions of the training modules, and of course the webinar series that will be including this one, and then the upcoming 4 recorded and available on the website. And of course the tables that were referenced and other materials for the revised NORS. So that's why we wanted to push this out early in 2019 to give states plenty of time to turn around and dig a little deeper independently in their own state before these go live on October 1. So we have made sure that we had plenty of time for Q&A. So if you will bear with me for a moment, I'm going to pull up that questions box because I know I saw several coming in as we were going through the presentation, and we will respond to as many as we can right now. Okay, so one of the questions that we had in, and I know that thanks Carol or Katie responded individually to some of these questions online during our presentations, but I do want to take some time and review those with you all because some of you on the line may have the same question. So someone asked, what does OAAPS, OAPS, stand for again? And just as a reminder from Louise's part of the presentation, OAPS is that system that the State Ombudsman Office will input the data, and that's called the Older Americans Act Performance System. So thank you for that question. So another attendee asked about states being required to train local programs on NORS codes and definitions. And so, yes, to respond to that question, as I mentioned alluded to a few minutes ago, NORC has been working on revising those materials, and they will be available here shortly for states to turn around and work with their local ombudsman entities in providing that training on the revised NORS. Another question we received, and Louise, I think you may be the best to respond to this one. Someone asked, shouldn't perpetrator be considered alleged perpetrator, similar to how it is with Adult Protective Services?
That is a very good point. And I don't have my table handy to see if that's how we described it. Let me see, I should have had that on my desk. But that would be correct. And so that's something when we go through the training that addresses complaint codes, we can clarify that in the training if it's not clear in Table 1. So that's a good catch.
So, Louise, if you want, I did pull up Table 1 while you were responding.
Yeah, I'm looking at my hard copy now.
Okay. I actually had a similar question when we were working on this presentation. So to answer the question, unless you wanted to, since you have it in front of you.
Go ahead.
Okay. So the data element is perpetrator, and then the definition is the person or persons who appears to have caused the abuse, neglect, or exploitation. So although it doesn't say alleged perpetrator as the data element, in the definition it does say appears to have caused. So I don't know if that helps, but that's how that's phrased in the table. Great, so good question. Thank you, and thanks, Louise.
Yeah, we struggled with what word to use around, because perpetrator is a very strong kind of adult protective services type of word, or so we had some other, 5 words to describe one thing, and we finally just said, the typical term that's used is perpetrator, so that's what we went with. But it is correct, it would be the alleged perpetrator.
Thank you. So another question was the new disposition of fully or partially resolved means that we no longer are distinguishing between those 2 levels of resolution as a disposition code. So Louise, did you want to speak to that at all?
Sure. I think sometimes from my experience and also from training around the NORS definitions, that sometimes it's really hard to know what's the difference between fully or partially, and then the other thing is that at ACL, when we report out, we don't break it down. We add back together fully and partially into one data element. So it just seemed like the disposition codes there were too many. There's confusion sometimes. It's hard to know how to split hairs sometimes. So we just merge that because we report it as fully or partially resolved. Now, if your state ombudsman, say, feels strongly that they want to keep partially resolved at the state level, they have that kind of flexibility. It would just roll up at the federal level to fully or partially resolved. Even now in NORS, state programs do things a little bit differently and then crosswalk things to the NORS codes. So that flexibility at the state level does not go away.
Thank you, Louise. So another question we received, and thank you for this clarification, was do assisted living facilities and adult foster care go into the residential care communities code, or would that be other? So Louise, I'll speak to that first, but feel free to jump in if further clarification is needed. So basically you need to look at how your facilities are licensed in your state. So assisted living facilities in some states and adult foster care have the same type of license, so those would fall under residential care communities. Louise, did you want to add to that? And others talk to the other setting a little bit?
Yeah, so right now you have what's called board and care in NORS, and you may not even know that. You might look at your software and you pick it was adult family home, it was assisted living, and that's what you need to know. Behind the scenes at the federal level, it's called board and care. So all that's changing is the term from board and care to residential care community, because that reflects the more common terminology that's used now to kind of generically describe settings like assisted living or adult foster care or personal care homes, or all of those types of buildings that provide services and supports that you provide ombudsman program services to. Likewise with the other code, in the current NORS there is an other code, and it's just called other. We've changed it to other settings, and we've also, because of technology, we now say if you pick the other settings, maybe your program serves adult day health, and you want to share, it's optional, but your program wants to share that information with ACL, you can then pick the other codes for whatever other it is, home care, adult day health, what have you, and then pick the type of complaint code that would be associated. So it's, again, if you are providing that type of service, you would, and code that now, you would continue to code pretty similarly, to how you do it now. And again, we'll get into more of the details of that, but most states don't report in other, so, and it just occurred to me, Amity, maybe there might be opportunity just to have a call with those state ombudsmen that do the other coding and maybe kind of work that through. So just a out loud thought.
Thanks, Louise. I just wrote that down, and I agree. I think that would be helpful. So we have several questions coming in. Just one second. Okay, so one question was about visits, and I think this is a great question, and we've heard this before, and one reason that, and this is one reason that the NORS, revised NORS reflects the changes in how we're counting visits. So the question is, what if a visit is both for a case and also involves visiting other residents on non-complaint issues? Louise, you want to speak to that while I look for more questions?
Yes, and we have worked that one out, and I don't want to say the wrong thing. I think we've come to the conclusion that if you go and follow up on a complaint, but then you also do a routine visit. Oh, Amity, I know we have the answer to this, and I don't have it in my head right now. I'm trying to, we'll have to get back to you on that. We have that one figured out very well, but I don't want to say the wrong thing because I don't have all of my kind of notes in front of me. So Amity, do you have the answer to that question handy? Because I don't have that training pulled up right now.
No, I don't either, and I'm afraid, honestly, to pull anything up on my computer since I'm sharing my screen. So I agree with Louise. How about we hold off on that question until we have the official answer and can respond, because as you can tell, there's a lot of information here and we don't want to misspeak. Another point, just to let you know what's going to be developed in the future, we will have a landing page or a separate section on our NORS page that we already have. We'll figure those logistics out. But after this webinar series, we will have some frequently asked questions about the revised NORS available, and this, I guarantee, will be one of them, just because we know there's a lot of confusion around that. So, so we'll discuss this more. And go ahead. Sorry.
Oh, well, we did a lot of mapping around this, and also thanks to the state of California, they kind of helped us think a lot of that through. How do you count it? So we do have the answer, but I don't want to give it to you right now and give you the wrong answer. Yeah.
Yeah, no, I think that's completely fair. And like we said, there's going to be ample time between now and October 1st to really drill down a lot deeper into these. And when we do the actual training module on visits and coding those activities, we'll dig into this a little bit deeper. So another question was, I did not think there was a disposition code of no action needed anymore. What if the resident may not want to withdraw the complaint even if the facility will not take an action? So just as a refresher, the 3 disposition codes in the revised NORS are fully or partially resolved, withdrawn, or not resolved. So Louise, for those type of situations where there's no action needed, where would that go? I believe is what the question attendee is asking.
Yeah, and I think I heard 2 different things though. I heard no action needed because the facility didn't follow up.
Yes, yep.
So I think it's 2 issues. So if you have, the resident has an issue and the facility won't take action, in other words, they won't cooperate to resolve the complaint, that would probably be not resolved because it's not resolved to the satisfaction of the resident. And if it's another situation where the resident says, you know, it's okay, let's drop it for now, that would be withdrawn or no action needed. I'm sorry, no action needed. Yeah.
Thank you. I agree. Those were 2 separate questions. So thanks for responding to both. So a question that some of you may have as well, we received, how do we get more trainings on this outside of our county or specific region if sometimes we're unable to attend these webinars? So just as a reminder, the webinar recordings will be available. And we at NORC, we do work closely, obviously, with state ombudsmen in providing training. So if there are training needs outside of the webinar series and in addition to what state ombudsmen provide to their statewide network, then you can definitely reach out to NORC and we'll see how we can assist in that. So thanks for that question. Okay. Sorry, we have lots of questions, so I'm trying to find the, just give me 1 second. So I'm not sure, I hope I'm not misstating this question, but I think I know what you're getting at. The question was, are codes updated on a timely basis, and when they're updated, how are we notified? So as far as updating the codes, as you may have noticed in Louise's presentation, there hadn't been a significant overhaul of NORS since it was initially implemented back in 1996. So these codes, the revised NORS, those are going to be the codes, definitions, activities until there's potentially another change. And Louise, I don't know if you want to speak to that a little bit, but certainly if there was any type of change, then the entire network would be notified. We would share that information on our website. Sometimes there are slight tweaks to maybe the NORC training materials on NORS. So for example, just as a reminder, on the current NORS training materials that NORC created, thankfully, many states and local ombudsman entities use those training materials, and oftentimes we get feedback if there's a need for clarification, and sometimes we may review and revise a quiz question or answer just to make sure that that it's accurate and that folks are understanding it. So anytime that we, NORC, makes a change to our training materials, we make sure to make a note that it's updated. So we encourage you all, if you are using our training materials, to make sure they're the most current ones. Visit our NORS website, which I'll show you here in a minute, and download what's available on our website. So the same kind of process internally for NORC on the materials we create for the revised NORS will be very similar. And we'll make sure to email if there's any significant changes. But Louise, I don't know if you want to speak to any potential changes on the revised NORS in the future and what that process would look like.
Yeah, so we cannot, from the federal perspective, we cannot just go and ask states to report information without going through a formal process and approval by the Office of Management and Budget. So the NORS codes that you see, or we'll see, have an expiration date on them. So basically they're good for 3 years. And so in about 2.5 years from the date of the approval, there will be a look at, do we need to change anything? You know, oh, maybe we should have said alleged perpetrator in the title. Let's change that. I mean, we literally cannot change anything on those tables. Like if I were to add alleged perpetrator now, it would not be correct because it's been approved as it is. So, you know, we may tweak some words, we may improve on a definition, we may say, well, you know, maybe we eliminated too many codes. Let's put a couple more complaint codes or disposition codes back in. So when that happens, that would be a public process where states would and individuals, of course, would have an opportunity to give feedback on that. So that will happen, and I will suspect there will be some minor modifications. But you would know of that process and, you know, training and everything. We kind of have to go through any big changes or small changes, just make people aware of them.
Thanks, Louise. So another question we received, would an unlicensed building or facility count as other setting, or should we apply what type of license the building should have and mark it as a nursing facility or residential care community?
Yes, and we do have guidance on that. That's for state ombudsmen. So state ombudsmen now, they report their number of types of facilities, nursing facilities, residential care. We've modified it a little bit where for the residential care communities, say if there were unlicensed homes that should be licensed as assisted living, they could report it that way. How you would do that in your individual complaint work, you'll have to kind of figure out how that's done in your state software system. Like you might develop a category called unlicensed, and it tracks to residential care if it's supposed to be residential care, or nursing facility if it's supposed to be nursing facility. So yeah, they generally would not be reported in the other category because they are, if they're to be licensed as a residential type of setting, then it should be associated to that setting.
Thanks, Louise. So some logistic questions that we received, asking if they'll get, the attendees today will receive training credits for the webinar series. That is something specific to your state program, so contact your supervisor about that. But you, in case someone missed it at the beginning of the webinar, all attendees, we will email everyone the link to the materials from today's webinar and where that is on our website. And we'll also send attendees of the webinar certificates of attendance. So if you are in a room right now with 5, more people than just you that registered for the webinar and they need credit for attending the training, then you can let us know, because it's impossible for us to figure out if more people registered or attended and there was only one registration. So we can work with you on that. Another question that we received is if we would compile the questions from all these webinars into an FAQ list. And actually, yes, when I mentioned earlier about that question about the visits and how to count those and how those would be in our upcoming FAQs, yes, we are going to go through and look at what questions we received frequently and that we feel need to have a response to that, and that will be compiled and included on our website after this webinar series. So great question, and yes, that will be available.
And one thing I wanted to say, because we've hit you with, a mountain of paper when you look at the tables all together, be mindful that for those of you out in the field, and then you come back in and you enter your data, or you use a tablet and enter it, at a coffee house or what have you, that a lot of this applies to the state office more than to you. The things that you do now, cases, complaints, that continues on. And most states, I don't know how many states entered complaint-related visits. When I was a state ombudsman, we always had that data, had the local representatives of the office enter that data because it was very valuable to really show how much work is going on. But if your state is not doing that, that would be a new thing for your state to do. But when we ask about the number of facilities visited, that's the kind of thing where you could, your software will take care of that. So as long as you do your data entry, the software will add things up, right? So I just want to stress to everybody, use your software, enter your data. Likewise with we used to ask for activities by, was it done by the state office or the local office or local programs? And reality is most of it's done at the local level. So we eliminated that, but instead we want to know, when you go to a resident council, is it at a nursing facility or a residential care community? So we want to get a better sense of how are those activities parsed out between the two setting types. And so that probably won't be a change for you. You probably enter your data and associate it to a type of facility. So again, it may not be new and different to you, but it'll be a big deal at the federal level. So I hope that helps you kind of think about it in that way. And as Amity mentioned, the Resource Center will be developing a lot of tools, also some kind of handy one-pager things that you can use because, it can be a little challenging maybe to whip out your 20 pages of complaint codes. So how do you kind of have something that's more manageable? So stay tuned for more, in addition to the webinars, more tips and support.
Thanks, Louise. Yes, she's exactly right. We are going to be working on those FAQs as well as a one-pager of the complaint codes without the actual definitions and tips and examples. So that'll be a quick reference that folks can use after initial training and reporting their work. So I am going to cut off our Q&A now so we can just roll into resources. But I want to reiterate that we did receive a lot of questions, and some of them were really in the weeds of reporting on specific codes or specific activities. So I did not respond intentionally to some of those because, again, on our upcoming webinars, we're going to go over at every single part of the training and the new codes, definitions, and activities in detail. And we're also going to have run through a few of the quiz questions, just as you would with the current NORS training materials. So we will go into a lot more detail. I simply didn't want it to be too overwhelming because I know, as we've mentioned, we've thrown a lot of new information at you today. So to wrap up, I just want to remind you of where our NORS materials are on our website. This is our landing page. It includes the current NORS instructions, the complaint codes, NORS data, the current NORS FAQs, NORS training materials, and then a link to the revised NORS data collection, which I'll go to next. But I do want to highlight right here on the second to last bullet on the NORS training. If you click on that, then you'll see the 4-part training that I'm talking about, and that's the one that will be revised and shared in the upcoming webinars. And this was that last bullet, the revised NORS data collection, again, obviously effective in October. This is where you can find the, an introduction to the NORS revisions, which is really nice because it kind of gives you a big overview of those revisions and what they look like. The tables that we reviewed today, as well as the crosswalk that was mentioned by Maria, and crosswalk both for the NORS overview and then the crosswalk for complaint codes. That'll give you a really good idea of how significant those complaint code changes are from the current NORS to the revised NORS. And you'll be able to see how some of those complaint codes were collapsed into one. So please visit those. These have been available on our website for a while. And we'll review them, of course, in a lot more detail in the upcoming webinars. Here is our contact information, so feel free to reach out to us. And again, these materials will be available shortly. So I just want to say thank you so much for joining us today. Thanks for being an active audience. We had a lot of questions coming in and hands raised, and we know you participated in the poll, so we really appreciate that engagement. Thank you for your presentations, Louise and Maria. Really appreciate your work on those. Please complete the brief evaluation that will pop up as soon as we close this webinar. It's really important to us to hear your feedback. And of course, we look forward to the next training later this month on February 27th. So we look forward to hearing from you then. Please let me know if you have any questions in between now and then, and we'll get back to those as soon as we can. So thank you so much. Have a great rest of your day.
Thank you, everybody. Bye-bye.